What if I told you one small region in Europe ranks 4th in the world for foreign investment in health innovation? This week, we sit down with the woman behind the numbers to find out how Catalonia did it and what the rest of us can learn. This is Pulse Amplify. Hello and welcome to Pulse Amplify, where we sit down with the leaders and changemakers shaping the future of health. Proudly brought to you by Pulse IT News. I'm your host, Louise Schaefer.
And I'm your other host, George Margellis.
Our guest today is Inma Rodríguez, Market Intelligence Manager at ACCIÓ, Catalonia's trade and investment organisation. It's basically the Catalan government's agency for business competitiveness and international investment. Inma recently led the development of the Digital Health in Catalonia Report 2026, which is one of the most comprehensive analyses I've seen of a regional digital health ecosystem and how it is placed globally. Inma sits in a unique position at ACCIÓ, analysing digital health markets, investment flows, startup ecosystems and public policy across Catalonia, Europe and globally. And the report doesn't just look at Catalonia. It benchmarks digital health globally, examines investment trends, public policy, startup activity, AI adoption, and of course, the emerging European health data space. And I think it also provides some fascinating comparisons between Europe, the United States, and Asia. So Inma joins us today to help unpack what the numbers are telling us about where digital health is heading and what other countries can learn from Catalonia's experience. Inma, welcome to the Pulse Pod studio.
Good morning, and thank you for this nice invitation. It's a pleasure to be here with you today.
Great to have you here, Inma.
So Inma, you've analysed digital health markets all over the world, but one thing that really jumped out at me was the country ranking. So in the report, it says that the US dominates with nearly a third of the digital health market, which is not a surprise. Fastest growing is in Asia and India at over 10%. So what's your take on where does Europe actually sit in this picture? And do you think Europe is keeping pace or falling behind?
We launched Digital Health Report last week in Barcelona with the Health Revolution Congress, which is one of the most important events in Spain and in Southern Europe for digital health. And in this report, we wanted to look at digital health in Catalonia, but it's of course interesting to have a look at what is going on in the world and which are the leading markets. And the situation in this case is we have in a leading position in the United States with 31% of the market. And as you commented, the fastest growing markets are in Asia, particularly in India, Japan, and China. In Europe, we have 5 countries leading the European ranking: the United Kingdom, Germany, France, Italy, and Spain. And if we have a look at the top 10, we have 4 European markets in the top 10 countries in the world. We also had a look at the expected annual growth rate. We are expecting growth rates around 5% for main European countries in the coming years. But Europe is in a good position. We are in this top 10 global market for European countries, and we are expecting to continue growing in the coming years.
The report forecasts a global digital health market reaching about $220 billion by 2030. We've seen a lot of turbulence in the market since the pandemic. Are we entering a more mature phase of digital health? And in particular, in the European market, being much more a public sector healthcare market compared to, say, other countries like the US, does that make the digital health market different in Europe?
It is true that 2020 and the pandemic was the big explosion for digital health in the world because of the needs of the market. Digital health solutions were applied in most countries, and governments around the world realized the importance of putting in place new solutions for health around the world. Having said that, it is true that probably from 2020 to 2025, we have had growth rates around 10%. From 2026 to 2030, we have expected rate growths around 5% of annual rate growths. So it is true that maybe we are in a more mature situation and specifically in the European market, but digital health is expected to continue growing thanks to some relevant factors that we identified in this report, such as the increase in public healthcare expenditure and the general population aging that Western countries are facing and will be facing in the next years. For instance, digital health can help to provide better health solutions for population. It is also clear that there is a greater demand for digital solutions, wearables, and telemedicine around the public in general. And it's also interesting that in this year, we have realized that digital health is not only about taking care of patients that have a disease, but it's also linked to the ability to maintain health of the general population. Because if we can guarantee well-being and a good health situation of population, governments can save much money. So we expect digital health to keep on growing in the coming years, although maybe it's not going to be growing at the highest rates of the first years after the pandemic.
Yeah, it's really interesting data. And Europe can get criticised for moving slowly compared with Silicon Valley, particularly around AI. Now, that criticism is more people who are more on the US side of things, where they don't like to regulate. But do you think Europe's focus on regulation, interoperability, and, of course, data governance is ultimately going to become an advantage?
Well, I'm a market intelligence manager and we analyze many technologies, many sectors. But in the case of digital health, it is true that regulation is critical. And probably it's one of the sectors in which public regulation has a higher effect on the application and the reality of digital health. At global level, for instance, we have the World Health Organization putting in place the Global Strategy on Digital Health 2020-2027, the global framework to enhance and guide principles for digital health around the world. But in the case of Europe, there are also several regulations and several initiatives that are trying to promote digital health. For instance, the European Health Data Space, it's going to be one of the big initiatives. We have also other initiatives such as the Digital Decade 2025 e-health indicator study that is enforced by the European Union to ensure that 100% of citizens have online access to their electronic medical records by 2030. 2030, it's one of the big frameworks in terms of time horizon for the application of some regulations being put in force at European level, but also then afterwards at country level. We have also some other strategies, some other specific initiatives that try to enhance digital health, such as the Spanish Digital Health Strategy 2021-2027 that forms part of the Spanish government and tries to make a reality digital health in public institutions in Spain, in Europe, and around the world.
So one of the things that differentiates Europe from the US market in particular, but other parts of the world, is the focus on equity. Having predominantly government-run systems provides care irrespective of income or status. Have you found that digital health has become a tool that's useful in that equity stage? I was in Europe earlier this year. I went to the event in Barcelona, but prior to that, I went to an event in Athens. And countries like Greece and Cyprus are very early on in their journey. Will there be a lot of learning across the European Union with the massive amounts of knowledge you've built up in Catalonia around digital health?
Yeah, definitely. Startups play a key relevant role because we have made an analysis of the Catalan specific ecosystem, and in Catalonia and also Europe, startups are one of the key relevant players of this movement because health is very linked to technologies. And to make it possible, we need the interaction of companies providing, for instance, of course, AI. AI is one of the key technologies, but also other technologies such as robotics, virtual reality, cybersecurity, because in a digitally connected ecosystem, we need everything to be very secure. Startups are very considered in the digital health ecosystem at European level, but also at world level. Actually, what we have seen is that there is also a leadership from the United States in the case of venture capital attracted by startups in digital health. But the second region in the world would be Europe, with 22% of the total amount of venture capital received by startups in the region in terms of digital health.
When I attended the 4YFN conference in Barcelona, the number of Spanish startups that were playing, but also the quality was quite impressive. And things like Barcelona Health Hub, where you actually have coalitions. I mean, to what degree are they part of the secret of your success?
I always say that in the case of Catalonia, we have an ecosystem of 2,400 startups. This is one of our focus of our work from ACCIÓ, Catalonia Trade Investment. We focus on deep tech startup ecosystems. I have to say also that the first sector in terms of startups in Barcelona in Catalonia startup ecosystem is the health sector. So we are very focused on this sector. And we always say that it's not only important to have companies and startups. They are our core business. But for us and for the government of Catalonia, it's also essential to have a network of other players in the ecosystem that can make this ecosystem more robust. For instance, Barcelona and Madrid Health Hub are our partners, our colleagues. We do many actions together because collaboration is essential. But not only them, we have also other organizations as BioCats, also very relevant in health sector in Catalonia and in Spain. We have also to mention the availability of hospitals because hospitals are in this digital health ecosystem. Some of those startups and spin-offs come out from the hospital research ecosystem. So they are also relevant. It is also essential to have accelerators in our startup ecosystem because thanks to them, we can help those startups starting with their business to become successful.
It's so impressive. You can hear it in your voice, Inma, not only how proud you and your organization and the whole ecosystem is of each other, but to have all the different players coming together, startups that are coming out of the hospital research ecosystem. That is rare and a great accomplishment for Catalonia. Well, time for a quick break. And when we return, we're going to be discussing the company that has injected 1.3 billion euros, yes, you heard that right, into Catalonia's digital health ecosystem. That and more after the break. One of the things you mentioned earlier as well was the amount of investment, which is amazing. Now, I noticed in your report too that AstraZeneca's Barcelona hub gets a mention in your report and that they have made a commitment of 1.3 billion euros. Surely landing an anchor like that must really change the gravity of the whole ecosystem.
Yes, that's really interesting because in digital health in Catalonia, we have a mixture of two different realities. On the one hand, we have the startups and those new ideas, new solutions that provide what the market needs in general. So we have a big amount of startups. And the other reality is the reality of foreign companies that have invested in Catalonia and are investing not only on, for instance, production facilities, pharma or biotech production facilities, but they are setting up in Catalonia their research centers, their digital innovation hubs, sometimes at a supra-regional level, not only to provide solutions for Barcelona, Spain, or the Iberian Peninsula, but for Southern Europe, for Europe, and sometimes even at world level. And this is the case of AstraZeneca that have set in Barcelona one of their global hubs for biomedical innovation. That investment has been really impressive for the ecosystem, and it's also attracting more investment from other multinational companies coming to Barcelona. Actually, we have a very nice ranking that is provided according to data from FDI Markets. It's a database from Financial Times. And according to this ranking, Catalonia has been the fourth region in the world that has attracted a highest amount of investment projects devoted to health innovation solutions. It's not just digital health. This is foreign investment in health innovation projects. Fourth region in the world in terms of projects. Fifth region if we are considering investment amount. So that's really impressive. AstraZeneca is one of our main tractors. That means that they have invested here, but many other multinational companies are also investing in Catalonia. For instance, we have investment from Roche, Sanofi, Boehringer Ingelheim, Bayer, companies that are setting in Catalonia their investment hub. Actually, we have identified 21 hubs from foreign companies that have in Catalonia their research and R&D center or their innovation center at a supra-regional level. In Barcelona, we have this mixture of startups on the one hand and foreign multinational companies setting up investment also in our region in R&D and added value activities.
Yeah, I can see now we're going to have all these startups listening to this episode. And while they're listening, they're going to be Googling, how do I get a visa to move to Catalonia? What an amazing ecosystem. And yes, for a small country, a relatively fourth region in the world for foreign technology investment in healthcare is incredibly impressive. Well done.
Thank you.
I had the opportunity to meet the team from AstraZeneca when I was there earlier this year. And yeah, the work they're doing there, and the reality is that is the major focus in Europe. So congratulations. You're right, Louise. Catalonia in itself is an amazing place, and I highly recommend it for anyone to go there. 65% of the companies in digital health in Catalonia are developing AI solutions. Now, Louise and I have had many discussions on our podcast about how AI is blooming in digital health. But why has AI become such a dominant part of the ecosystem in Catalonia? Is it just a new phase you're going through, or do you think AI really will be a major change element in health delivery?
As I mentioned earlier, we analyze many sectors and many technologies. And frankly speaking, we are seeing that AI is making a revolution around the world in all sectors. 65% of all the digital health companies in Catalonia is developing solutions for AI. Agentic AI can help and can benefit health. And then the other aspect in which we have seen that AI can be implemented in digital health, it's in the diagnostics. AI can help to make a diagnostic of diseases. It can help also in some digital therapies. For instance, I believe that this rate of 65% of companies using and also developing usages of AI is going to be higher in the next years.
I did notice this year at Mobile World Congress, obviously AI was a major factor. But the one thing that did catch my attention, which I thought was very impressive, was the Barcelona Supercomputing Center. They had a big stand in the middle of MWC, and they had quite a number of health-related technologies. So obviously you're doing a great job of integrating the various parts. And the fact that you cover multiple industries is very important. So I have to give you congratulations for that aspect of it.
Yeah, thank you. Actually, Barcelona Supercomputing Center and ICFO, which is the Quantics and Photonics Centers for Research in Catalonia. They are two big scientific infrastructures that are critical to our ecosystem and help us make more research, to also get closer companies to research. And AI and quantum science can be also implemented thanks to the existence of the Supercomputing Center and ICFO.
And part of your report too, you actually surveyed hospitals and found that 80% rate their own digital maturity as only moderate, although that's not too bad for healthcare, but 100% of them expect to do more. And I think there's a real honesty in that gap, but also I'm wondering whether they, because of everything else that's happening in the ecosystem here, there's a high expectation on themselves, knowing that they can do better, there's more they can do. So what do you think is actually stopping these institutions from progressing faster with integrating digital health innovation into just the day-to-day healthcare system?
Yeah, in this report, we analyze the number of companies we have in Catalonia making digital health solution, but we wanted to see which was the reality. And the truth is that we have seen that digital health is not so implemented as we would like to be. On the one side, systems are not always so easy to implement new solutions or new systems. One of the barriers was the cultural aspects of doctors, for instance, used to work in a way, and they were a little bit reluctant to change the way of working. Although, of course, it's going to be more efficient with higher rates of productivity. One of the factors was cultural aspect, I would say. The other one is budgets. Unfortunately, and this is one of the things that was mentioned also at Health Revolution Congress, was that more public funds are needed to invest more on hospitals, public and private hospitals, so that more of those technologies can be really implemented. So budgets would be another thing to keep in mind. And finally, from the patient side, there is also a question of habits. We had some data, for instance, at primary care, face-to-face versus telemedicine or telephone consultation. And 66% of all the consultation at primary care in Catalonia are made face-to-face in person. So we have to make more efforts to make digital health implementation in Catalonia, but also in other countries of the world, a reality. We expect to have higher rates of implementation in the coming years.
So your report closes with 7 trends for 2026. And I think these trends are very focused on healthcare and also global trends: agentic AI, predictive and preventive medicine, health data spaces, which I think is a very important area. And we probably could spend a whole episode just talking about that. Tech for specific population segments like femtech and age tech. Which of these do you think healthcare leaders are underestimating today and which require changes in the way we deliver care in our business models?
I believe that from those 7 trends, I would focus on AI. For me, AI, it's like the queen of the trends in the report, more implemented and the one that is going to have more impact and it's going to change business models of companies, hospitals. But the second one for me that it's really impressive is personalized medicine, predictive medicine. I think that here we can get real benefits and impact on patients. That's a technology that can also provide real solutions for instance, cancer that needs personalized treatments and personalized diagnostics in some cases. So I think that those 2 are like the big ones, the ones that we need to keep a closer eye on. The other trend essential for 2026 is data spaces. That's critical. That's real necessary for the real application of digital health. And here we are seeing that data spaces, public data spaces are being created around the world. We have a European Union data space that is becoming a reality. At Spanish level, we have another one. And also for the government of Catalonia, that it's really necessary in order to be able to cross data, to have all the data in one single place, to enable the interoperability of data. And thanks to the use of AI, for instance, in those data spaces, I think that is one of the trends in which we are going to be more focused in the coming years, because it is essential to have a better use, a better knowledge of all the data we have. We have at the moment dispersed, not on one single place, and data spaces is one of the trends that is going to change and that is going to need new business solutions implemented in the next years.
The European health data space blew me away when I was there earlier this year. And the reality is AI is so reliant on good data. And by having a centralized, managed data pool, I think it's a great strength. So again, kudos to my European friends for driving that agenda.
Yeah, absolutely. Yes, so much we can learn. All right, let's fast forward. We're going to have this conversation again in 2030. What headline would you like to most see then about digital health in Europe?
For me, in 2030, I would like to see a headline talking about real implementation of digital health in the public and private healthcare systems in Europe or in the world in general. I would like to see, I just mentioned that, for instance, in the case of Catalonia and primary care, we have non-face-to-face attention of just 36% of the total patients. I would like to see a headline, for instance, 80% of the healthcare attention is done by telemedicine and only face-to-face attention when it's really needed. But I would like to see a headline linked to real implementation in hospitals.
Yes. Well, let's make sure that happens. And it sounds like you guys have got all the ingredients in place to see that future. We've had Jordi Piera Jimenez on the show as well, who is still working for the Catalonian government, but also now running Open Air as well. He also keeps us in the loop with what's happening in this wonderful part of the world. Inma, thank you so much for joining us in the studio today. We will link to your fantastic report so that people can find it easily and dissect all of the numbers in there. Really great work. Thank you so much.
Thank you so much. It's been a pleasure.
Fantastic. Real pleasure.
Thank you for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by me, Louise Shaper, with audio engineering by Ivan Jurek of Octopod Productions. Thanks to Emily Mara, co-founder and publisher of Pulse IT News, for all of her support. And big thanks to you for listening. Make sure you subscribe, follow, and rate us wherever you get your podcasts. And of course, do not forget that you can visit pulseit.news to sign up for the e-newsletter and explore Pulse IT's massive digital archive. Send any feedback or topic suggestions to me and George at pulsepod@pulseit.news. We always love to hear from you guys. See ya.